What's up, guys? Fix your shoulder using our 3-step NTS method without pills, injections, or even surgery. Why shoulder injuries don't heal for most strength athletes is because they go to a PT clinic that throws them on the arm bike, has them do pulleys or banded exercises for months and months and months. What you need to do instead is figure out the root cause of the issue that is causing your shoulder pain in the first place. It could be coming from 1, neck referral, 2, thoracic spine restrictions, and 3, scapular dysfunctions. Once you know the cause, then you can properly address it with the proper rehab plan. And this is going to lead to a long-term fix, so you don't have to keep paying a chiropractor for adjustments or paying a massage therapist for massages. So listen up, today's topic is the #1 strengthening exercise for a weak shoulder. This exercise targets 3 out of the 4 rotator cuff muscles and also turns on and activates the wrist and forearm stabilizers as well. But before we dive into the exercise, let's take a step back and watch this video from Anatomy in Motion, which describes how 80% of shoulder cases are caused by weakness of these specific muscles.
Why does an immobile scapula create shoulder pain? To raise our arms high, the scapula needs to glide across the rib cage in a rotation-like motion. This movement is primarily driven by the serratus anterior and opposed by the levator scapulae and rhomboid muscles. The levator is a tonic muscle, meaning that if it's not exercised enough, it becomes overly tight. The rhomboids are generally content with this tightness because it makes their job easier. Unfortunately, this compromises the movement of the scapula, and without it, our shoulder joint must operate in an exaggerated range of motion, which leads to pain.
Awesome, guys. So hopefully you found that video helpful to explain kind of how important that serratus anterior muscle is and how the levator scapula and the rhomboids play a role in how your shoulder blade upwardly rotates. So without further ado, let's get into the exercise for today, which is called banded upside down kettlebell press. So for this exercise, what you're going to do is first get into a half kneeling position, 1 foot in front of the other, have the opposite knee forward of the arm that you're going to be working. Flip a kettlebell upside down. Typically we'll start with anywhere from 5 to 15 pounds. And what you want to do is you want to drive your arm out to the side at a 45-degree angle from the body and then press upwards almost like you're doing an overhead press, finishing with your elbow and your bicep by the ear. Now it's important to note that a band should be set up around your wrist that's pulling your arm inwards. And you might be asking, why am I using a band with this exercise? Great question. The band's purpose is to activate and turn on more of the external rotators like the infraspinatus and teres minor and the rear delts. This band is going to be pulling your arm inwards, meaning you have to use the opposing muscles called your external rotators to stabilize that shoulder joint. And all you're going to do here is you're going to engage your core, engage the glutes, perform your presses, right, with that band pulling inwards, keeping a nice 90-degree angle, keeping your wrist stacked right over your elbow the entire time. Don't let it cave in, don't let it cave out, keep it nice and neutral as you press up and over your head and come back down to start. Okay, you could take breaks in between if you need to. This is a very challenging exercise that is completely fine. And for the best results here, this is based on research and what I've seen work with our clients, you want to perform 3 sets of about 8 to 10 repetitions in total. Now, there are 2 ways to modify this exercise if it's too difficult or too soon. Number 1 is removing the band. So perform the exercise with just an upside down kettlebell and take the band out of the equation so it's a little bit easier to do. And then number 2, use a dumbbell instead of using an upside down kettlebell. If you use a dumbbell, it's going to take more stability out of the equation. It's going to be easier to perform. Now, if you're on the opposite side and it's too easy to do and you want to progress it to make it more difficult, you can 1, use a heavier kettlebell, or 2, you can use a thicker band to pull you or move your body further away from where the set point is. And that is how you turn on majority of the muscles around the rotator cuff with some of the surrounding scapular muscles. We typically will give this exercise, which is a little more advanced, to people who are in month 2 of our 3-month program. Now, if you're a strength athlete and maybe you're having pain with overhead press or bench press, maybe it's too soon to do this exercise because every time you try and do it, even with lighter weight, it still hurts. Now, if this is the case, listen up, because I'd love to send you free training that can help. Just comment with the word shoulder and I'll send you how the NTS method works and how we help apply it to your workout routine to get you pain-free. And as always, be sure to hit that like button, subscribe, so you don't miss any of our new videos coming up for the weeks and weeks to come. Take care, guys.